Hello, my YouTube family. This is Dr. Lee, and I'm back with you. Another video from Pearson VUE, who's now being called Credentia. And the skill that I would like to demonstrate today is skill number 9, dressing the client with an affected, weak right arm. So right arm is very important. I want to keep that in mind. So this is another short skill. It's only 11 steps. I'm going to go ahead on and demonstrate the skill, and then we'll come back and talk about the skill as we normally do for these Pearson VUE Credentia skills, and I'll be right back. So let me go out and knock on the patient's door. Good morning, Miss Mary. How are you doing? I'm closing your door to provide for privacy. How are you doing today, Miss Mary? My name is Dr. Lee, and I'm here to help you get dressed. And I understand you have a weak right arm. So your right arm is over here. This is going to be your right arm. All right, I'm going to go ahead on and get some shirts for you to put on, and I'll be right back. With this skill, you must give the patient a choice of what to wear. So I went and got 2 shirts, and I'm going to let the patient decide. Miss Mary, would you like to wear the blue and black shirt, kind of little squares, or the red one? The red one? Okay, great. Great choice. I'm going to take your bluish one and hang this back up in your closet. Okay, great. I'm going to put this shirt right by your right arm because your right arm is the weak arm. And for me, when I put the shirt on the right side, it lets me know this is where I'm going to start putting on the shirt. So we take off the strong arm first. So the strong arm is going to be the left side. So I'm going to go over to the left side and take the gown off. So Miss Mary, I'm going to leave you covered. I'm going to untie it. I'm going to take off one sleeve off of the strong arm first, leaving you under the cover. I'm going to move the gown over to your weak arm, which is your right arm, and let's just go ahead on and slide it off of the right arm. Great, good job. Any pain or anything? Okay. I'm going to go ahead on and put this in the dry linen container. Now, since I took off the strong arm first, I put on the weak arm first, and I put the gown on the weak side to let me know start where the shirt is at. Okay, or I said I put the gown, the shirt. I put the shirt on the weak side. So her right arm is weak, so I'm going to get the shirt so that her right arm goes in the gown first. All right, I'm going to put that over you. Miss Mary, I'm just going to raise you up just a bit so I can bring the shirt on around. And now we're going to put your strong arm through the next sleeve. You can just bend it for me. Great, good job. I'm going to go ahead on and fasten up the buttons here. Just a couple more, Miss Mary. Okay, get you comfortable. Are you cold or uncomfortable? Am I hurting or anything? You good? Okay, great. I'm going to go ahead on and hold the shirt while I pull this sheet down, and then we can flip it on top of your shirt so we keep you covered. All right, great. Now, I need to give you the call light. I know that your right arm is weak, so I'm going to put the call light in your left arm, on your left side. Okay? Right there by your arm. All right, so you can reach it. Just push the red button if you need me for anything. Okay? I wash my hands, and I'm through with that skill. Okay, so let's talk about it as we normally do. Make sure we have a good understanding of this particular skill. So the skill is dress the client with an affected weak right arm. Number one, we explain the procedure to the patient. Number two, we provide it for privacy. Number three, ask the client which shirt he or she would like to wear and dress him or her in the shirt of their choice. Now this is very important. You don't want to, because this skill will be done on your partner. You don't want to go and get a hospital gown to put on this person. It's very plain. Pearson VUE or Credentia said to ask the person which shirt they would like to put on. Okay? So you have to put them on a shirt. All right? Avoid overexposing the client by ensuring that their chest stays covered. Number 5, remove the gown from the left, because that's the strong side, first. Then remove the gown from the right. So we remove the strong side first, then the weak side. Number 6, the opposite, because I'm getting ready to dress the client. Before dressing the client, dispose of the gown into the soiled linen container, which is what I did. Now, number 7, critical point here. Assist to put the right arm through the right sleeve of the shirt before placing the garment on the left arm. So in other words, when you go to put that shirt on, you put the weak arm in first, then the strong arm. Number 8, move the body gently. Remember, you're dealing with patients who are sick. You don't want to be rough with them. Number 9, finish with the clothing in place. Give them the call light and wash your hands. So hopefully this demonstration and just sitting down talking about some of the critical steps gave you a good idea of how to do this particular skill. If you have any questions whatsoever, please leave me a comment down below. I'll try to answer it within 48 hours. Keep in mind, I'm a full-time instructor in Texas, so I may not be able to get to you right away, meaning within a few hours, because sometimes I'm busy with my own students, but I do have at least a 2-day turnaround with answering questions. All right, and hopefully that'll work. If you like the video, please give me a thumbs up and hit the subscribe button. This is how I'm able to keep more videos on YouTube to help you or other students that may be in your situation is trying to find material to help them pass the state board. And all of this is free to you all. I just ask that you please subscribe and hit the like button. All right? All right. So if you have any questions, I'll be looking forward to hearing from you. All right. Take care. Wish you all the best as you take your exam. I know you're going to do great things, just great things. All right? So go out and be good. I will see you in the next video. So long.